This comes amid more promising news in the race for a vaccine as Cambridge-based Moderna releases early findings showing their vaccine is nearly 95% effective.
In addition to that, it comes a week to the day since Pfizer rolled out similar findings from its trials.
12 News reporter Brandon Truitt was on the story then, and he's working the latest today live from Providence. Brandon?
Well, Kim and Brian, doctors across the board agree that this is good news. Another vaccine proving highly effective. It could be approved by year's end.
The light at the end of the tunnel just got a little bit brighter.
Brown University's Dr. Ashish Jha making the rounds on network morning shows, admitting the worst of the virus is in the weeks ahead.
What the Pfizer vaccine, what the Moderna vaccine do is give us hope that in a few months, this will really start turning around.
On Monday, Cambridge-based Moderna surpassing medical experts' expectations, early findings showing a nearly 95% effectiveness rate from its COVID-19 vaccine trials. Just last week, Pfizer announced a 90% effectiveness rate in theirs, both on track for FDA approval in a matter of weeks.
I'm really excited about the news.
Moderna says their vaccine is like Pfizer's in that it will require 2 doses a few weeks apart. However, Moderna says theirs can be passed out more easily. They plan to have 20 million doses earmarked for the U.S. by the end of the year.
I will have that arm ready whenever it's ready.
I want to see more data.
The question for health officials, will the public trust it?
I feel confident in the steps that our government takes to make sure things are safe.
Companies can claim what they want to claim, but as long as there's sort of strong empirical peer-reviewed data to back up their results, then, there should be confidence by the public.
And some of the doctors that we've spoken with over the past couple of weeks say they want to see more data too, really from both companies. Moderna's timeline of distribution matches very closely to Pfizer's, with the first round going out possibly by the end of the year for first responders. Widespread distribution, guys, likely not going to happen until late spring.
All right, Brandon, so let's pick up on that point. There's wide recognition about some of the challenges ahead in terms of distribution. Dr. Jha also talked about that today.
Right. So during his appearance on CBS this morning, Dr. Jha said that he feels like more work has to be done in this, saying that states really have a lot to still iron out.
We've got to get tens of millions of vaccines out to states, to pharmacies, doctors' offices. That needs a lot of planning. There has not been a lot of that planning happening out of the federal government right now. There's been some, but we need a lot more of that. And then we're going to need to hand that off to the Biden team, who's going to have to pick it up and run with it.
And he goes on to say that Moderna's vaccine that they're working with right now could be transported a little bit easier. It has to be kept at refrigeration level temperatures, just like we all have in our kitchens. If you might remember, Pfizer's really, really low numbers here, below 70 degrees, below zero at least, in order to keep that and keep it effective, guys. So the difference there between the two vaccines.
2 Mondays in a row with big news on the vaccine front. Brandon, our thanks to you. A second week here.